Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, June 16th, and I'm here with Edward Brubaker, our Living Branches President and CEO, for what potentially could be our last coronavirus update, I think. It's a good update. We don't have any COVID cases on our campuses right now, but it feels a little strange to be back doing an update.
Yes, it does. And when I think back on how many updates we did and how regularly we did them, it's really quite amazing to think back over those years. I remember the first videos, before we did it in a more production style, I'd be standing out in the lobby here of the shared service office saying, don't forget to wash your hands and don't touch your eyes and nose and mouth. And wow. If we only knew at those point in time what we would have been doing, how many videos we did, but also more importantly, what our residents and team members went through over the last couple of years, it's just amazing. But at the end of the day, to me, it shows the resiliency of the human spirit and how we can get through things that we might not think we can because of working together and focusing on a common goal.
Yeah. Now that we've been a couple of months with face masks, I just can't imagine going back to regularly, month after month after month, working in a healthcare unit or personal care and wearing an N95 and a gown and all of that.
Yeah, very challenging time.
Yeah.
It really was. Mm-hmm.
Well, we're here saying this might be our last COVID video because technically the federal pandemic declaration has expired. So what does that mean for Living Branches?
Well, May 11 is the official date of the end, and it really removed the emergency orders, and so it means a lot of different things. And we can still have latitude to do what we choose to do if we want to make things more stringent than what's out there. But it changes reporting requirements, it changes testing requirements, it changes vaccine requirements. There's a lot of different things that are now changed. Interestingly enough, though, for a period of time, I think it's till the end of 2024, unless it gets changed, we still need to report COVID cases on a weekly basis. And so it's not done for us behind the scenes, but generally for our team members and for our residents, it's becoming more like any other communicable disease that we might need to manage. And how do we do that? What are the good infection control policies that we need to use?
Yeah. One of the things that I think people may potentially notice, at least, is that some of the communication requirements have changed. And so that will be something that's a change that's visible for people.
Right, exactly. And some of those things have to do with the notes we were putting on our website to say how many cases we had, the notifications that needed to go out to families, particularly in healthcare, and just all those kinds of things that were part of the requirements. Now, we expanded it beyond healthcare, beyond the regulatory area there in healthcare, but the reality is it becomes more of communication like we have done in the past for other things when we had outbreaks of whatever the disease may be.
Yeah, so my plan, at least for the communication side of it, is that starting Monday, I think it's June 26th, we're going to take the web page down that has to do with COVID, and we won't do the mass emails anymore to notify people when there's been a positive test. We will, of course, still call individuals to let them know that they've tested positive. And if they're in personal care or healthcare, we'll call their emergency contact, but it's going to feel a little different. I know there are some people who would be very, very happy, and I know there are some people who are probably a little uncomfortable with this step.
Yeah. So you're saying that little dialogue box or whatever you want to call it that you click on that says COVID-19 updates or coronavirus updates, that will be leaving our website after 3+ years?
That will be leaving the website after 3+ years.
Wow.
Yeah.
That is a milestone.
Yes.
We never thought would be that long, but that's wonderful, yeah.
Well, and we know how many people click on the pages, obviously, and there's not a lot of clicks. So, and it's just not as concerning as it was for people in the beginning, obviously.
Well, that's right. And the reality is the last couple months, we haven't had cases.
Yeah.
Or very few. Not that we haven't had any, I shouldn't say, but there's very few. And the severity of them is very different. Interestingly enough, I remember the day in April where we had said, this is the day we're going to announce that no longer are masks required in personal care and healthcare areas. And we said, we're going to stay the course. Yes, there'll be times where we might feel we need to change it for a particular area, but we're not going to be across campuses all the time. And literally, I think it was 2 hours after that email and notification went out that we had notification that, I can't remember if it was a team member or a resident or who tested positive, and we needed to look at what to do and contact tracing and all that kind of thing. And I remember thinking about that, saying, wow, you got to be kidding me, number one, that this happened that quickly. But we stayed the course and said, these things will happen, and we're going to stay with our decision. And frankly, things worked out. It didn't become an outbreak like it would have been years ago, potentially. And so things worked, and it just proved that we were continuing to move in the appropriate directions. And it just feels very good to be at this place.
Yeah. And maybe we should reassure people that although we're not formally continuing with our coronavirus task force in the way that we have previously, we're still alert for notifications about changes in the virus. We're paying attention to what's coming out from CDC and all of those things. So if it mutates again, which it probably will, in a way that could be more detrimental for the health of our community, we'll pay attention to that.
Right. And that would be just like we pay attention to a lot of different infectious diseases. And our infection control nurse happens to be on maternity leave right now. But she does a great job with paying attention to all those kinds of things.
Yeah. Well, we have other more exciting things to talk about too in our update.
Well, we do, but maybe just before we jump into that, and I'll take my cheat sheet here just so I don't forget anybody, but I did want to give a shout out to persons who were on the coronavirus response team. This was a group that I can't even tell you how many hours were spent, both during work time and evenings and weekends, setting the tone for the organization, responding to information that was coming out from governmental sources, et cetera, communicating, just all the things that went along with that. And the original members of the group were Bruce Alder, Lori Borglum, Monique Cole, Nancy Donnelly, Dr. Dan Hamowitz, Alex, yourself, Steve Myers, Murray Sheeran, and Kathy Schott, and myself. And that was a group that spent countless hours together, and frankly went through the majority of the thick, if you will, of the pandemic. We had 3 of those persons actually retire in the last couple years, and some of them may have been, wow, I'm ready to retire. Maybe I thought I could work a few more years, but it's challenging. And so here at the final, the group that was in March of 2023 included Lori Borglum, Monique Cole, Dave Zwald, Dr. Dan Hamowitz, yourself, Alex Metricardi, Steve Myers, Sierra Crino, Kristen Tim, and myself. Yeah. And so that group has changed over the years. We had actually a number of infection control nurses and different people that came in and out. But there were actually 6 of us, I guess, that were part of that core group that started together and ended together as well. And I just want to shout out to them for the great job and great work that they did, and really commitment to each other, to our team members, to our residents. But not just them, our residents, right? Yes. It was a horrific time. And yes, there were questions. Yes, I got calls, we all got calls from concerned family members or concerned residents. But I would say when I reflect on those couple years, the vast majority were asking legitimate questions, were concerned about legitimate things, and also recognized this is a hard time. They didn't just call to yell at you because they just wanted to yell at someone. They called because they were concerned, wanted to know reasons, and yes, sometimes maybe they did raise their voices and were excited about things. But it really, overall, I felt families and residents and everyone in that category just handled things very appropriately and very supportively. I would also say our team members did just a fabulous job. I mean, I remember when people were wearing N95s and face shields and gowns, and remember seeing them come out of the nursing centers sweating profusely because it was so hot to wear all this stuff. But they did it because it was their job, but also because they cared about our residents and cared about making sure our residents were safe. And so kudos to everyone, residents, staff, team members, board, family members. It was a challenging time, but people really stuck together and supported each other, and I really do appreciate that so very, very much.
I mean, I think I've heard multiple people say this in different ways, but this idea that I would never want to go through that again, but there's not a different group of people that I would want to go through that with.
Yeah, that's right.
Yeah, yeah, especially our residents. The things that we ask them to put up with, amazing.
Yeah. I mean, when you think about it, I remember getting a call on the second Mother's Day from a person whose mom was, I think, well into their 90s at that point. And it was like, is there a way we can make this happen? And so I made some calls, and ultimately I think we could have worked it out, but she had worked out something else. But the point is, that's tough, right?
Not to be able to see your loved ones.
Yeah, no, for us fathers, I guess Father's Day is not a big deal, right? Mother's Day, though.
That's right.
But no, they're both big deal. But to think about putting yourself in the shoes of that family member and her mother 2 years in a row, that's tough. Yep. And so people were resilient, they were long-suffering and supportive, and just, very appreciative of that.
Yeah. It's so nice to be in a different place.
Yes, absolutely.
Yeah. And we have exciting things happening on campus now.
We do.
Including celebrations and new buildings.
Yeah, exactly. And we hope to open up first phase of Doc Terrace on the Doc Woods campus in the nursing center, healthcare area, the week of probably, July 4th or somewhere in that range. We'll be opening it, but open houses the week of the 26th just to show the building off. But the interesting thing is, this is not the reason we were planning to go to private rooms or primarily private rooms that are not all private. But the pandemic also showed us that, wow, that makes such a difference too. Yes. And so that is a good thing that we're able to create the vast majority of our rooms for private. And we're looking forward to showing that to people the week of the 26th. Very excited about that. We then will rapidly move into phase 2, which is a renovation of Willow View Wing, and then after that, the renovation of Ivy Lane. We are hoping to start next week at Souderton. We have some paperwork to get signed. I'm still waiting on some of it and working on that. But we intend to start very shortly, and had a wonderful groundbreaking ceremony in early May to celebrate that time. So, a lot of great stuff happening. We're planning other things for the future as well, other building projects and other initiatives as part of our strategic planning. So a lot of good things happening, but great that we don't have to be dealing with the details, all the many, many details of COVID anymore. And it's nice to be talking about other things and doing other things too.
Very much so. So, well, hopefully many of the people who are watching this video will have a chance to come out and see Doc Terrace during the open house the week of the 26th. Residents and family members have gotten invites, so hopefully they'll be able to come. Right. It'll be a year before we're getting to do this at Souderton, hopefully. And I'm excited to be moving forward.
Yeah, and it really, I've been obviously in and out of the building a fair amount, and it really is, it's just aesthetically beautiful too. The colors and the furnishings, and there's more space available for people, the light, exactly, and being able to have, in Country Cottage at least, everyone has a private room, and other parts of Doc Terrace as well, and it'll be the same at Souderton as we get that underway. But I think it's just so important for the dignity of our residents and their families and just the interactions. And I'm just excited to see the faces of residents and family members as they tour the new area, because it really is fabulous.
Yep, agree. So, well, hopefully we'll see many of you there. I guess we'll do this again at some point in the future if we have more updates to provide. But thank you. It's been quite an adventure.
It has been an adventure.
Yeah.
And maybe we'll have to post pictures of the different hairstyles during the time of the pandemic and all the other things we joked about and outtakes and things. But it's been quite the journey.
Yeah.
Great to be here. And thanks for your work.
Yeah.
And thanks to everyone for their support.
Yeah. Well, thank you, Ed. Thank you to our viewers. Again, if you have questions, you can still email me at coronavirusquestions@livingbranches.org, and we will see you again, perhaps on some future edition. Thank you. thank you all. If you have questions, you can still email me at coronavirusquestions@livingbrain. Wait, I forgot the website.
That would be.
I was gonna jump in there. I'm like, wait a second. I probably shouldn't be. Like, who's that guy talking?
Oh my gosh. Sorry, you're going to have to cut that.
Go back. Rewind.